While the number of new cases continues to drop, experts warn the decline may not last. CBS reporter David Begnaud on the looming dangers coming this fall and winter.
It was another weekend of parties around colleges and universities. Young people gathered in Washington Square Park near New York University for the second consecutive weekend. This crowded house party took place near the University of Kansas, and this video of a party near Florida State University shows very few people wearing masks. According to a New York Times survey of more than 1,600 schools, colleges and universities recorded more than 36,000 coronavirus cases in just the last week. An outbreak at Michigan State University has county health officials urging all students to self-quarantine for 14 days. But not everyone is convinced that that plan is going to work long term.
Eventually, most people are going to get it.
And that is exactly what worries infectious disease experts like Dr. Michael Osterholm.
With the colleges and universities openings, with the spillover that's occurring, with people experiencing even more pandemic fatigue, we're going to see these numbers grow substantially.
This morning, there are encouraging signs on the vaccine front. Listen to what the CEO of Pfizer told Margaret Brennan on Face the Nation.
In our base case, we have quite a good chance, more than 60%, that we will know if the product works or not by the end of October.
The vaccine, developed by the University of Oxford and AstraZeneca, will resume clinical trials in at least 2 countries. This comes just days after they were put on hold. CBS News medical contributor Dr. David Begnaud.
A neurologic side effect happened in a second patient. The trial was stopped, and it was reviewed by an outside group of people called a Data Safety Monitoring Board. All of them felt that it was not related to the vaccine, and therefore they could proceed with the clinical trial of the vaccine, that the benefit was obviously significantly greater than any potential chance of harm.
Now, AstraZeneca told CBS News they're working with health officials in other countries, including the FDA here in the U.S., to see about getting other trials back up and running. Dr. Begnaud, who you just heard from, said he's pretty confident we're going to have at least one vaccine by this fall. But he believes it could be another 9 months, 9 more months before we have enough of a vaccine for everyone in this country who wants to get one. David Begnaud, CBS News, New York.